Good afternoon. County Executive Rich Fitzgerald here with the weekly update on weekly briefing on COVID-19 with Dr. Deborah Bogan, Director of the Allegheny County Health Department. A lot of news that we're going to talk about this afternoon. One piece of news we thought we would be talking about would be some of the mitigating orders that would be coming out from the state, which I believe are still going to be coming most likely tomorrow at some point. But obviously the news that has broken this afternoon about Governor Wolf testing positive for COVID-19. Certainly want to send our best wishes to the governor that he has a speedy recovery and everything is fine. I talked to the governor about an hour ago. He seems in really good spirits. He seems very healthy to this point. No symptoms. But I think it really talks about the fact that no matter how good we all try to be as far as following the mitigating strategies, and I know this governor, the one thing about the governor is he's a stickler for rules and following protocols and listening to medical advice, etc. But this virus is so, it can spread so easily that we do need to continue to do all of our best efforts to do everything we can to prevent the spread, not only for ourselves and our families, but for the entire community. But this governor is just, I'm a big supporter. I've been a big supporter for a long time. I like the way he operates. I think he's very, very caring about this state and how we do well. He's a husband. I certainly hope Francis is doing well. Father, grandfather, son, daughter, son, etc. And just wish the governor very well. The other piece of news that came out today is the announcement of the retirement of Mark Cherna, our Director of Human Services. And, I could go on probably for a half an hour talking about the accolades and the things that Mark Cherna has done. One thing I think really exemplifies what he's done is the organizational legacy that Department of Human Services has undergone over the 25 years that Mark Cherna has led that agency. I could start with the fact that he's the only director remaining from the county commissioner form of government that we had over 20 years ago. He's also only the second director that has even remained from the last administration, from Dan Honorato's administration. So what Mark Cherna has done for working for Democratic and Republican administrations throughout the years has been just brought a professionalism, a legacy of professionalism that has occurred. And we have gotten national accolades in this county government because of the things that Mark and his department have done. I serve on the National Board of County Executives of America, and every year when I go, they talk about Mark Cherna and the innovative things that Mark has done in bringing a department together, whether it's the behavioral health and intellectual disabilities, children, youth, and families, drug and alcohol, the Department of Aging, working with our immigrant community, and quite frankly, the people that have the most needs. And certainly through COVID, Mark's work in the department of under his leadership has been instrumental in trying to protect the people that in normal circumstances are in difficult situations. And certainly with COVID, it's exacerbated it even more. So I want to wish Mark well. He's going to be staying for a few more months, but it's a well-deserved retirement for the great work he has done for this region, for Allegheny County, for my administration. I'm just a huge fan. So it's with mixed emotions that I announced that he announced today his retirement from county government. He will leave behind many big shoes to fill. The other thing I will say, and I know all around the state, when the state is considering their budgetary and the rules that come out of the Department of Human Services at the state level, they always look to Mark for advice and guidance on how to do that. So I wanted to wish him well and the governor well. Again, we thought today there were going to be some announcements around mitigating strategies. Obviously, they are needed. Dr. Bogan has talked about that, and she will talk about that more in detail when she comes up. But these numbers are not good. We know the positivity rate, the number of cases, the number of hospitalizations, the number of fatalities, all of them are continuing to rise and continuing to go to places we didn't think they would be, and we feared they would be many months ago. When that strategy comes out tomorrow, we want to be prepared to try to help as much as we can on the economic side of things, because there's both of those, the health and the they're tied, they're linked together. So Let me just go through some of the details of what we're going to try to do for people and as we help as this comes about. So with these additional restrictions that's expected to limit the spread of COVID, there will also be additional need that will likely continue throughout the rest of the year and on into 2021. And to support those additional needs, the county manager has committed an additional $1 million to the United Way for its Students and Families Food Relief Fund, SFFRF. These additional funds are estimated to provide an additional 125,000 ready-to-heat nutritious meals to families, and these meals supplement existing resources at the county, including those programs offered by the school districts, the summer food programs, Greater Pittsburgh Community Food Bank, and other food pantries and programs. Additionally, the manager has authorized another $1 million to be committed to the United Way Emergency Basic Needs, the EBN network. And since March, 2,220 referrals were made to the EBN network, resulting in more than $476,000 in direct financial assistance, with an average grant size of $564, going to more than 800 people in the community. As the pandemic continues, there's an increase in the number of applicants as well as an increase in the amounts requested. Our network partners have leveraged a wide variety of other funds, programs, and resources to assist in lieu of or in addition to direct financial assistance. Supplemental resources accessed include federal and state housing assistance programs, food pantries, long-term benefits such as WIC and SNAP, career development programs, and others. The top requests have been for rental assistance, utility assistance, and access to food. For assistance, we urge residents to call 211 or to go to the website of covid.pa211sw.org and then complete the online application. Access to other services and programs administered by Human Services under MARC can also utilize 211 to be connected to the things that you need. The 211 gateway can also be used for people seeking food assistance from the Greater Pittsburgh Community Food Bank. In addition to calling 211, individuals can contact the food bank directly using their phone line of 412-460-3663. Again, we're in uncharted waters here with the difficulties that we have seen over the last couple of weeks. We need everybody to really participate, follow the guidance, follow the good advice that Dr. Bogan, Secretary Levine, and so many others have given. We wish, again, the governor very speedy recovery. I hope he's doing okay. We need his leadership. And now let me turn it over to Dr. Bogan. Dr. Bogan?
Good afternoon, and thank you for joining us today. First, my thoughts are with Governor Wolf, Francis, and the governor's staff. I'm glad that he is doing well. So let me start with just a few numbers: cases, hospitalizations, and deaths here in Allegheny County. Our 7-day rolling average case count for December 2nd through 8th is 832 cases per day. This includes cases diagnosed with either PCR or antigen tests. For the same 7-day period, our percent positivity for PCR tests is 12.6%. Hospital admissions of Allegheny County residents continues to climb and are at an all-time high. At the start of November, there were about 45 county residents admitted to the hospital each week. By mid-November, that had doubled to about 100 new admissions per week. And by the end of November, it had doubled again to about 200 new admissions per week. This is putting strain on hospital staff and our healthcare resources. We know this number will continue to climb in a lagged response based on our rising cases. We don't expect this number to peak until sometime in January or even February without serious mitigation efforts. Now to deaths. That's an even more heartbreaking numbers. We reported 34 new deaths today, the highest report of the pandemic. Recently, Port Authority announced that 2 of its drivers passed away from COVID-19. And with the spread of the virus we are currently experiencing, it is likely that we all will know someone that has had COVID, has been hospitalized, or has died. In the first third of November, the county lost 15 individuals to COVID-19. In the middle third, we lost another 53 individuals. And in the final third, we lost another 70 individuals, for a total of 138 in the month of November. The number of people we lost in November could fill 3 Port Authority buses and then some. And so far in December, we know of 32 deaths in the county. And again, the number of our friends, colleagues, neighbors, and relatives that will die in the coming months without serious mitigation efforts is heartbreaking to consider. I extend my condolences to the families and friends who have lost loved ones during this pandemic. I could take action on my own and, like over the summer, put in new safety measures that apply to only Allegheny County. But I don't think that would be the most effective approach. The crisis facing Allegheny County residents is really a regional crisis. It's a state crisis, and frankly, it's a national crisis. Like Allegheny County, our surrounding counties are also experiencing rapidly increasing rates of COVID-19 and strained hospital systems. An Allegheny County-only mitigation strategy won't stop people from crossing county borders to work, to go to restaurants, attend weddings, funerals, visit friends and family, or attend sporting events. We need the entire region to be included in mitigation efforts. Across our region, our healthcare systems are linked. We are seeing increases in patients in Allegheny County's hospitals and in hospitals across the region. As community hospitals around the region reach capacity, they will need to rely on the larger urban centers we have here in Allegheny County. So action is needed because mitigation strategies and measures really do work. And we have evidence to support this. We saw them work over the summer when the spread of the virus was much more localized, and we were able to reduce the spread with limits on bars and restaurants. We've seen it work in many parts of the world. For example, mitigation strategies have substantially slowed the spread of the virus during this current wave in France, Germany, and many other countries. By putting limits on private gatherings, restaurants, venues, salons, and other businesses, these countries have successfully decreased the number of new cases and new hospitalizations. Our success and our return to normal really depend on you. The spread of the virus is being driven not by government's action or inaction, but by personal choices made by each and every one of you. When you choose to meet others without a mask or engage in more risky behaviors, you put everyone's health at risk. It's like a series of dominoes. When you attend or host a party with people from other households, people are put at risk of spreading the virus unintentionally. Some people at the party may get very sick, may end up in the hospital, and could die. We've seen it happen throughout the pandemic from gatherings like weddings, retirement parties, birthday parties, and even coffee together in the break room. The virus spreads from there. It infects other family members, friends, coworkers. Many of the cases of COVID-19 in our long-term care facilities, in Port Authority, among employees at a host of businesses, started with employees who were exposed outside of work, but rather at social gatherings. I get it. You feel like I have constantly telling you to do this or that, even inside your own homes. I'm doing this because it's incredibly important. You may be healthy, you may have ready access to testing and top-notch medical care, you may be financially able to quarantine or isolate, but not everyone around us has those same opportunities. You might not end up in the hospital, but someone will. And the more people who do, the thinner and thinner we stretch our collective but limited healthcare resources. And the closer and closer we get to situations where we have to ration care, where hospitals are forced to decide who gets treated and who doesn't, who gets a bed and who doesn't, and who lives and who doesn't. We saw this in the pandemic in places like China and Italy and New York. And I want to prevent that from ever happening here. I'm not trying to scare you, really. Fear doesn't motivate us to be our best. I'm trying to get you to see that we are all in this together, and I know that Allegheny County works best when we all work together. So thank you, and please remember to stay safe and to be kind.
This This first question is from KDKA. You have both referenced forthcoming health orders from the state. Do you anticipate a complete shutdown similar to the one that occurred in March?
No, we don't. I think what we have learned since the beginning of this pandemic is more strategic strategies to isolate where the risky behavior or the risky potential exists. So I think the term shutdown is much too strong. I think what you're going to talk about is limiting certain gathering numbers and activities and times and those type of things. So I think that's exactly what Dr. Bogan and Secretary Levine and the governor and others are contemplating. And let me say this, just to build on what Dr. Bogan said, nobody is doing this to scare people or to have people feel badly about it. Nobody wants to tell people what to do and control their lives and their homes and those type of things. It's really to just try to keep people safe. And they know what can be done to keep people safe, and we just hope people will be able to follow that. And it's not just following it 8 hours a day at work, it's following it, literally we have to follow it all the time or we put ourselves at great risk.
This next question is for Dr. Bogan from WTAE. With some intensive care units at over 90% capacity right now, what options are you considering to ease the burden on hospitals? Also, with COVID patients taking up nearly 1/3 of beds at some area hospitals, should people be delaying elective procedures?
You know, I've answered this question before, I think, and I think it's really important to know that every hospital in our region has very carefully thought through multiple levels of strategies to address increasing case numbers, and because their plans are so careful and thoughtful, they don't need us to police them. They really are able to make those choices well. And there are, all of the hospitals that are seeing increasing cases have already started to implement their plans, and they're working. So that really is the approach, is to have each individual hospital, but they're working not just individually together as a region. So I will say that we're very unique here in Allegheny County and in our region, that our chief medical officers from across the region meet together every week and share best practices, help each other out, and talk about strategies to work together. And I think that's fairly unique. And so they, as a region, have come together as chief medical officers to really work on these plans. And so I trust in their excellent planning, and they know their hospital, their staff, and their ability to manage better than I certainly do. And so we work with them and we listen to them, and again, their plans are very sound.
This next question is from WPXI. We are seeing different school districts handle instruction in vastly different ways. Some are 5 days a week, some are hybrid. One district just announced that they will be all virtual for most of the next month, and some haven't returned to in-person instruction this year. What are the current recommendations from the county health department, and is there any new or recent evidence of spread within schools?
So our case investigation team follows schools incredibly closely and looks really for evidence of spread within schools. And we rarely see spread within the classroom. It's not that it never happens, but it's a really low risk situation or a low risk activity. However, we do see some spread in schools in places like break rooms and lunch rooms, again, where there's less control, and related to sports activities. And again, but many of those, not all, but many can be traced to social activities related to those sporting events. And so, again, the schools are taking their guidance from the Pennsylvania Department of Education and the Pennsylvania Department of Health. And we're there as the health department to help them as they come up with individual cases and helping them to make individual decisions around a particular case and isolation and quarantine. But the guidance is coming from those state level departments. But again, schools remain a low risk transmission setting.
What do you say to businesses? I apologize, this question is from KDK. What do you say to businesses who make most of their annual revenue in the next few weeks during the holiday season?
This is probably the most difficult part of the type of decisions that our state leaders, health department, people like myself have to wrestle with. These decisions are not made easily. These decisions are not made without a lot of angst, a lot of sleepless nights, because we know the impact that this has on people's lives, from the owners themselves to the workers who work in these businesses and rely on this income to pay their bills. Again, I've said this before, that I really am hopeful that the federal government does do another round of CARES. They did so early on in this pandemic, and it was very helpful for a lot of people. If we had a hurricane or we had a flood in the Gulf, in the Northwest, wherever, we would be rushing in to help those people in an emergency, in a natural disaster. We are having a medical disaster, a viral disaster that has occurred. And it has occurred on certain aspects of our economy much more than it has on the rest of us. If you are in the hospitality business, if you're in the restaurant, the food business, the hotel business, the travel business, the entertainment business, you have been affected much more than people have been in law, finance, office, research, manufacturing, construction, et cetera, et cetera. So we know that this is not an easy thing, particularly at this time of the year. We know that retail does makes a lot of its revenue during the last month of the year and in the holiday season. That entertainment occurs when people have Christmas parties, when people have holiday parties and end of the year parties at their companies and in their communities and in different organizations. Unfortunately, those are the type of activities that lead to the type of spread that we have seen over the last month. So these decisions are not made easily, and we want to do everything we can to help along these lines. It's one of the reasons why, in the earlier question, is this a total shutdown that's coming? And the answer was no, because there are other opportunities for businesses to operate safely. Some with gatherings that require gatherings are not in that realm. So it's a very difficult situation. The governor doesn't do it easily. The secretary doesn't do it easily. Dr. Bogan, myself, these things are not done without a lot of angst and a lot of worry.
This next question is from the Pittsburgh Business Times. You talked about the potential for rationed care, Dr. Bogan, which you want to avoid. Can you talk about whether there have been discussions at the county and medical level about the potential? And can you also say if there are any standards that have been set up to guide physicians?
Again, we hope we never get there, and I think, again, the plans of our hospitals should be robust enough to not have to ration care here. And again, if and when, I hope it never does come, our chief medical officers will work together on a strategy. I know that there have been some discussions on, for instance, when remdesivir was very early on and limited supply, there were discussions about how to appropriately use remdesivir within our community effectively. That supply is increased, and so there's not those issues. But that's the kind of work that they do together. As issues come up, they work together. So I would refer you to that group to give more comment. But again, they are a thoughtful and really forward-thinking group of people who are making thoughtful decisions together.
This next question is, has the county traced specific cases to Thanksgiving? And if so, can you tell us how many?
I don't have the exact number, but I can tell you for sure we've had cases related to Thanksgiving gatherings. I don't have that number off the top of my head, sorry.
This next question is from Spotlight PA. How will new mitigation efforts be enforced? Has the state communicated with the county on what type of responsibility the county may have to carry out with these new mitigation measures?
No, again, we're sort of waiting to hear, and we don't have an answer for that at this time.
And this final question from the Pittsburgh Business Times. What is the latest about an alternative site of care? The convention center was mentioned previously as an example for an overflow of post-acute or even acute COVID patients. How closer to reality are we?
Again, plans are there if we need them, but it's not a reality at this time.
That was the last question. If there's any closing remarks.
Again, we see that we are getting in a very dangerous position with the numbers that we have. Dr. Bogan laying out a lot of the numbers that we've seen over the last month or so. I also want to wish and send my condolences to our 2 Port Authority drivers who've lost their lives to COVID-19. Their families, the suffering and you know, the emptiness in those households and in those families now is something that can't be replaced. And we see again and again how our frontline workers, whether they're bus drivers, whether they're our caregivers, whether they're our teachers, our food service workers, the people that are on the front line, EMS, et cetera, you know, they come to work every day and they come to serve the public and do their job, and they really do need to be thanked. We do it again and again, but it's never enough for the work that they continue to do. We also are hopeful and thankful that there is a vaccine that is already now being distributed in the UK. It started, I guess, just yesterday or the day before. We're hopeful tomorrow that the FDA is able to approve the Pfizer vaccine that can then start to be distributed, and then hopefully next week the Moderna vaccine, and maybe a couple of more after that. And we can get to a point where people can be protected and we can go back to a more normal way of life that we all enjoyed before the middle of March. However, we're not there yet. We still have a lot of work to do. We have a lot of protections to give each other in our communities by continuing to wear our masks, continuing to limit our gatherings, continuing to keep physical distance from each other so that we don't become infected by this deadly virus. You don't want to be part of spreading this to your family or your friends or your community. None of us do. We want to make sure that we're doing everything we can to keep our community safe, to keep our families safe. So let's continue to work together. Let's continue to listen to our medical experts. They've given us good advice throughout, and they'll continue to do that throughout this pandemic.